my name is Jasmine Pabla, student ID 1005538882. So I'm going to do my Osce for wound dressing. It's for James Brown, who's had some sutures done on his left arm after he had a fall. So we'll just start the Osce then. Hi James, my name is Jasmine and I'm going to be a nurse this afternoon. So we will be doing your wound dressing for the arm. You happy for me to continue? And so we'll gain consent. Then we'll check the patient's name, UR number, date of birth and allergies. So James, do you have any allergies at all? So then we start with our procedure. So James, do you want to go to the toilet before we do the dressing, or are you feeling comfortable? And I'll just get my things ready and I'll be back in a minute. So then I'll get back to my station. I'm going to give my wound trolley a nice clean and we'll give it about 30 seconds to dry up. I've got my rubbish bin ready here, and then I'll do my hand hygiene. It goes the same, we'll give about 30 seconds to dry. I've got my equipment ready, I've got my dressing pack, I've got my normal saline, and I've got my new dressing. So I'll open my dressing pack. We have to make sure that we maintain a aseptic non-touch technique, which means we don't touch the key sterile areas. So once we've got everything ready, okay, and I've got my new dressing here. We'll avoid touching that as well to maintain the sterility of the field. Okay, then we do the hand hygiene, and I'm going to put my gloves on and go to James to take the old dressing off and assess the site of the wound for any signs of infection. Hi James, so I'm just going to take your dressing off and I'm going to have a look if you've got any pain or any signs of infection. So do you have any pain at all? So if the patient says yes, so we will get a doctor to come and have a look, or we might give some analgesia before we do the dressing. And since I've now taken the dressing off, I'll dispose it off in the bin, which will then at the end be disposed off in the clinical waste bin. So then I'm going to have a look, so we'll touch the wound a bit. If there's any redness, any exudate, any swelling or tenderness, or any signs of infection. In this case, I don't see anything, so we can continue with the dressing further. So I'm going to take my dirty gloves off and dispose them off. I'm going to do my hand hygiene again. And give it about 30 seconds to dry. Now we've got different forceps here, so to maintain the sterility we use two different forceps. One is for the sterile field and the other one's the dirty forceps for the wound. So I've got mine here, so we give the wound a nice clean from one side to the other, usually from the inner side to the outside, and we dispose it off. using the same forceps. And we use the clean forceps again. And we use dirty forceps. Give it a nice clean again. And then we dispose it off. You can dispose off the dirty forceps once you're done with cleaning. Then we put our new dressing on. As per the instructions, we don't have to tape it, but in real case scenario, it will depend on the wound care plan of the patient. So once we're done with the dressing, we'll clean and dispose everything off. And the bin goes in the clinical waste bin. Then we go back to our patient and ask John if he's got any pain again. We assess for pain using the PQRST tool, and we'll tell James that if he feels any different or if his arm's a bit sore, he can call the bell anytime and we can get a doctor to see him. And that'll be the end of the Osce. Thank you.